Hello everyone, in this video we are going to see in detail about how to do a ribbon post and core restoration. This technique is not only limited to ribbon material, we can use this technique for any ribbon type of material, that is polyethylene material, which can be used for doing a post and core restoration. Especially this is good for the ribbon material or the interlig material or the infibra material. So infibra and interlig are quite affordable materials compared to that of ribbon. So you can use this technique for doing post and core of any tooth, especially for the tooth where the core angulation have to be changed. With a prefabricated fiber post or metal post, changing the angulation of the core compared to that of the root is not possible. But with this technique you can do it, and this technique is quite easy, very easy to learn and master, but you need some special instruments. By the way, when we are going through the presentation, I will explain about all those things in detail. So stay tuned and let's go into the presentation. Okay, so we can, just for a practical purpose, we can divide the steps in doing this polyethylene ribbon type of post and core restoration into 7 steps. Basically there are no some steps something like this. So just for explanation and just for understanding it in a proper systematic manner, I have divided it into 7 steps. The first step is being the post paste preparation. Second, we have to choose the appropriate plugger for placing the material. And the third is selecting the appropriate type of ribbon material. There are a variety of types available. And next step is to do the post paste bonding. And next is the ribbon preparation. And the sixth step is the placement procedure. And finally, doing the core buildup. Let's see one by one. The first step is the post paste preparation. So the ribbon, for placing the ribbon post and core restoration, there is no definitive post paste preparation technique needed. If it is narrow, leave it narrow. If it is wide, leave it wide. So for most of the other type of post and core restorations, it has to be a very specific dimension which have to correspond to the size of the post that you are choosing. But for doing a ribbon post and core, the post paste preparation is almost easy, or it can be negligible compared to any other technique. So if you are not very familiar with the post paste preparation, put it in the comments. I will make a separate video how to do a post paste preparation with the easiest possible instruments and the techniques with minimizing the errors. So after doing the post paste preparation, so here for this example, there is a maxillary central incisor and I have prepared a post paste and just a simple post paste, nothing extraordinary over there. So after doing that, we have to choose a plugger. This plugger is used for placing the material, that is the ribbon material, inside the root canal. So we should make sure that the plugger should go till the length, full length of the post paste preparation. So I have put the stopper over there and I have pushed it to the full length, where make sure that the plugger have to reach the full depth of the post paste that we have prepared. After that has two purposes. One, we know that how much is the length or the depth of the post paste preparation, so that we can measure it and we can cut the length of the ribbon material. And the second advantage is just to make sure that the plugger reaches till the full length. So if the plugger is not reaching to the full length, our placement technique may not be very good. So depending upon the size of the root canal, you can choose a plugger of 0.8 or 1 millimeter in diameter. Here I am choosing a plugger of 1 millimeter in diameter. So after that, now we have measured the plugger and we have measured the length. The next step is to measure the length of the post paste that we have prepared. How are we going to do that? The plugger, that we can measure it and we have to multiply it into 2. That is double the length of the ribbon material and maybe little excess for the core So for example, here it is 10 millimeter. Then inside the pore space, we need 2 folds of the rebound material. So 20 millimeter. And let's keep 22 millimeter of the material is going to stand out of the pore space. So 2 into 2 is equal to 4. So if the pore space length is 10 millimeter, we need 24 millimeter of the rebound material. For example, if the pore space is 8 millimeter, then we need 8 plus 8, 16 plus 4, 20 millimeter of the rebound material. So this calculation of the rebound material is very important. Why? Because if you have taken too short of the length, then your entire rebound material will go inside the pore space when you are placing, and you will fall short of the material for a core buildup. And if it is too long, it is very difficult to trim after placing the material. So always we have to be very careful with the selection of the length after. And the next is you have to have this special scissors. This is the instrument that I told. It may look like a very simple polyethylene material, but cutting these materials are very difficult. Here we need a special instrument called the rebound scissors. They are actually the carbon steel material which are needed for cutting this rebound material. The normal scissors cannot be used for cutting this rebound material. So I have measured with the help of a floss. I have taken 24 millimeter as per this example, and depending upon the canal size, there are 2 millimeter width of material available, 3 millimeter available, 4 millimeter available. This is a 4 millimeter rebound material. So if your canals are narrow, you can use 2 millimeter width, and with the help of the determined length, I am cutting it with a rebound scissors. So it is very a strong material. It may look like a ordinary material, but actually we need to cut it very carefully. Otherwise, the normal scissors, the material will start shearing off instead of cutting it into 2 pieces. Now I have taken exactly the 24 millimeter of the rebound material. Now let's keep the rebound material separately, safely, and now we are going to prepare the post space for bonding purpose. I am using an etchant and I am placing the etchant. So I am going to use a material which is an adhesive resin cement. If you are using a self-adhesive resin cement, then there is no need for etching and bonding agent application. If you are using an adhesive resin cement, here in this example, I am going to use a multi-link resin cement. Multi-link needs to be etched for maybe 5 seconds. I recommend etching for one more reason. That's because if there are some debris which are present in the pore space, by etching we can remove that also. So we have etched it, and after that I am going to apply this multi-link bonding agent, which comes in 2 bottles, the bottle A and bottle B. We have to take 1 drop from each of the material, mix it, and we have to apply it inside the pore space. Make sure that you are not applying so much excess material also. So having this excess bonding agent application may interfere with the placement of the material, because this excess bonding agent may get polymerized inside and it may hinder the placement. So make sure that you are applying only the adequate quantity of the bonding agent which is needed. Again, if you find this multiple steps very difficult, use a self-adhesive resin cement. So this etching, this bonding, all these procedures can be eliminated, and directly we can place a resin material inside the pore space. So after applying the bonding agent, we have to use a paper point and we can dry the excess material out, so that then there is no need to light cure. So this is a self-curing bonding agent, so there is no need to light cure the bonding agent. So the next step is the preparation of the rebound material. In this rebound, you can see that I am taking a rebound material, and before application of the bonding agent to the rebound material, preferably you can bend it into 2 pieces. So that will help in the placement procedure. So if you are using it as a single piece, and if you are trying to place it, it will be extremely difficult, as initially I have attempted to place it in a single piece, but actually it is quite difficult. If you are following this technique, it will be very easy. So bend it, but at the same time, preferably use minimum of the contact with the hands or the gloved hand with the ribbon material. So we have to minimize the contact. So after that, you have to use a bonding agent and you have to apply it. Ideally, you have to use a adhesive which is free of primer. For example, if you remember that the 3-step etch and rinse system, you will get one primer separately and you get one adhesive separately that have to be used separately. So that adhesive which is free of primer have to be used. If not, Ribbon, they supply a specific adhesive for this purpose. That's quite expensive. If not, you can use any universal adhesive material. Here I have used tetric N-bond universal adhesive. You can use an universal adhesive in order to wet the ribbon material with the adhesive material. So this wetting is very important. After this, you have to be quite fast. Why? After wetting the ribbon material with the adhesive, this may become quite hard. So it should not be exposed to the light, and preferably it can be kept closed in or it can be kept covered, and it has to be used. Do not expose it into the direct light. It may get polymerized. So here, for the placement of the resin cement, I am going to use multi-link from Ivoclar. It is one of the material which I love so much and I use for most of my crown cementations. And this is a wonderful material which we can use it. So what we are going to do is, in the post space, we have already etched and we have applied the bonding agent. So after that, I am injecting some of this resin cement inside the root canal. Again, do not place an excessive material, just fill the canal with this resin cement, and make sure that, try to understand that if you are using a self-adhesive resin cement, so this etching, bonding and all these things are not needed. Directly you can do this. So after that, so I have placed it, and this is the most crucial step in doing this. So take the ribbon material which is wetted in the bonding agent, place it and use the same plugger. So we know that. So we have to make sure that, and place the plugger in the middle of the bend and push the material deep inside, if possible with a single push. If you are trying to push it little by little, it may not go. So after the single push, then you can pack the material tightly inside. So this may be the only technique sensitive step while doing. So it has to be straight. No, you can pack it in any way that you want. So pack it well, pack it tightly. You can apply some excessive pressure so that the material will go inside and get adapted to the canal. So pack it again and again. So the problem of using a very small plugger is, if you are using a very small plugger, the plugger may go inside the canal, but at the same time it may disrupt the material also. So it is better to use a material of appropriate size. So the second beauty of this material is the core. Now the extension, the fibers, you can manipulate it in whatever the direction that you want. If you want to bend it labially, you can bend it labially, lingually, mesially, distally. So that you come across in many clinical situations. Patient, there may be one tooth which was proclined and the patient would have traumatized and it would have been broken. And now if you are placing a crown, it is going to stand very far. And if you are trimming the labial surface, and there will be very less material. So in these situations, you can bend the core material, that is the fiber, and you can light cure it. Once you light cure it, the material will become hard. Why? We have impregnated it with the adhesive material, and there is a resin cement. Cure it well, and in the resin cement is a dual cure material. So this finishes the placement procedure. And what's the next step? We have to do a core buildup. For doing a core buildup, you can use any material of your choice. I prefer to do the conventional restorative material like a bulk fill material for doing a core buildup. But if you are familiar with Luxa core or any core buildup material of your choice, you can proceed with doing a core buildup. So we can see that I have placed this bulk fill material for doing a core buildup. It just, there is nothing complicated. Depending upon the material of your choice, you can do it in 1 or 2 increments. Do it. So after that, I have got a good core buildup, and I took a radiograph. You can see that the rebound is a radiolucent material. So there is, unlike this the prefabricated fiber post, the glass fiber post, there is no need to place the rebound to the full length. If you can go deeper, you can go deeper, not a problem. This is a radiolucent material with some resin cement here and there in between, and trust me or not, this is going to be a super strong material. It may look like a very feeble material to initially. That's how what even I thought when I was a beginner using this material. I was thinking how this is going to provide a good core buildup, but use once. The next advantage of using this material is it has an unlimited shelf life. 2 years, 3 years, 5 years, you can use this material. And other than that, you may have to invest it in a ribbon cutting scissors. Other than the resin cement will be available in your clinic. The post-paste preparation you are going to do regularly for your clinical practice. Anyhow, you will have all the instruments and equipments for that. And the plugger you will be having in your clinics. And what else? The core built-up material will be available in your material. So only thing that you have to get is the ribbon material or interlink material or in-fiber material and the ribbon cutting scissors. If you are not planning to invest it in the ribbon cutting scissors, then you can use this Goldman scissors, which have the carbon tips that's used in surgeries and in periodontics. That also can cut, but may not be very precise as similar to this. So try to invest in this. Again, this is going to be a beautiful restoration core buildup that you will do in your clinical practice. And I hope that you have learned something good in this presentation. To summarize this, first you have to prepare the post paste. Then you choose a plugger in order to measure. Make sure the plugger reaches till the full length of the post paste that you have prepared. Then you have to choose the ribbon material. Choose the length. In this example, you know the 10 millimeter post paste for 2 layers, so 20 millimeters, and 2 millimeter of excess for both the strings, so 4 millimeters, so 24 millimeters. You can choose the width of your choice, 2 millimeter, 3 millimeter, or 4 millimeter. Cut it, and then you have to prepare the post paste bonding. Again, if you are using a self-adhesive resin cement, there is no need for doing a post-paste bonding. Directly you can prepare the ribbon. For wetting the ribbon, you have to use a universal bonding agent or use an adhesive free of primer. After that, inject the resin cement inside the post-paste, then place the ribbon. Try to place as deep as possible. After placing, pack it well, then do the core buildup. I hope this technique is quite easy to perform. It may look like multiple steps, but you try to do it in one of your clinical cases, you know how simple and beautiful this technique is. The biggest advantage I would say is, one, you can change the angulation, and the second is, especially in case of young patients, the small boys and girls with the insides are fractured and the root canal is going to be very, very wide or big, and if you are putting a post, it is going to stand in the middle like a very small one, and the space, and ribbon can also reinforce the root. So in case of weakened tooth structure, like an immature tooth which has undergone trauma and the root wall is very thin, so the ribbon can reinforce that also. So it's not for ribbon, this is not the only applications. We can use it in inlay, you can use it in large restorations, you can use it in post-endodontic restorations, you can reinforce any class 2 restorations with this material, and there are multiple uses. So if you want to learn more about this ribbon or this polyethylene ribbon type of materials, put me in the comments. So two things: one, if you want to learn more about this post face preparation, put me a comment, and second, if you want to apply how to use a ribbon for an inlay fabrication or a large class 1 restoration, like in a post endodontic restoration, like a class 2 restoration, just put it in this. And it can also used for a splinting of this in periodontics and the luxated teeth. You can use this polyethylene ribbon materials, and for tooth replacement also you can use ribbon material. So it has multiple use. Maybe if you have not used ribbon in your practice, it may be the time to change and start using it. So thank you for watching till the end. Next week I will come up with another presentation. Until then, stay focused, and I am Dr. Benin. Subscribe to my YouTube channel and share my videos so that it will be an awareness for everyone to watch. So have a nice day. Thank you for watching.